My first job out of undergraduate college, university, I was working in a children's psychiatric hospital. At the time, I thought I was going to be a football coach, a teacher. I was still kind of determining what my path was. And I knew I loved working with people, motivating people. I was a college football player, so I knew the value and importance of sports in my life. So I took a full-time job to work in a children's psychiatric hospital, ages 5 to 10. So it was my first
Wow.
experience being exposed to the psychiatric system in the United States. And to be honest, I can only say that I was appalled by the treatment of young children. It was my first experience with drugs as healthcare and as mental health care. As you would imagine, that's such a vulnerable age, ages 5 to 10. Most of those kids came from very adverse backgrounds. Many of them were abused and neglected. And so their behavior was what you would expect from, a child who was in a violent and abusive home environment or experience. They would often be very vigilant, scared, anxious, and act out physically. And then in the United States healthcare system, that aggressive acting out was viewed as psychiatric in nature and required hospitalization because they posed some form of danger to themselves or others. And in that experience, it was between the years of 1998, 2000. It was really kind of the height of psychiatric drug use for children, trying to identify psychiatric conditions as a brain disorder. There was a lot of money being funded into the National Institute of Mental Health and a lot of push scientifically into doctors to think about mental illness similar to any other health condition. Some of the terms that were thrown out were like insulin for diabetes. So in a lot of ways, they're trying to provide drugs to target specific brain chemicals to manage symptoms. And what I saw was the oversimplification of very complex problems and kids being drugged. And I use the word drug, not medicated, drug. They'd be placed on multiple psychiatric drugs. And some of the responses to those drugs were absolutely horrifying. I still have, nightmares at times thinking about how some of the kids were treated. So
I'm sure you do.
it was sedation as mental health care. We'd see kids that were, drugged and sleeping 16 hours a day. Others would develop horrible side effects like tardive dyskinesia. And the viewpoint in that perspective was that if a kid decreased their aggression, well, then that was a effective treatment. So to decrease aggression, you would see kids just really, really being horribly sedated. Now, with any kid, or any human being, there's a range of responses that some would have. Some became more aggressive, some became suicidal, some developed side effects, others became very lethargic.
This is just breaking my heart just listening to this, because a child, and the first, I had Dr. Bruce Lipton on the podcast recently, and he spoke about the first 7 years of your life where you're being programmed, and these children have been programmed through, whether it's, aggression, whatever's happening at home. That wasn't being dealt with then. They weren't dealing with the children. You weren't required to deal with the children in a more sympathetic way to get to the root cause, to maybe use other techniques to try and find what had gone on for this anger to be in their bodies. None of that was explored, right?
No, it was a short-term fix and send people back into the communities on multiple psychiatric drugs, with the kids' behavior being identified as a psychiatric illness, not a normal and expected reaction to abuse or neglect. And so, to make a long story short, I think that experience motivated me to walk down a new path and direction in my career, in my life. I eventually became a clinical psychologist, received a doctorate in clinical psychology, and have thrown myself into scientific literature to try to understand what works and for whom. And I had to resolve the conflict that existed between what I was seeing in clinical practice, the harms I was seeing in various settings that I was working with, versus what is told by the medical authorities, that this is safe and effective frontline treatments, and that children, teens, and adults who are struggling emotionally and behaviorally, that these drugs are somehow corrective and they are part of a safe and effective mental health treatment plan, when it's not what I was observing.
Okay. I'm just going to stop you there because I'd like to understand your thoughts on mental health. We're seeing mental health soaring out of control around the world, especially since 2020. And, could you give me any statistics for how many people are actually on medication in the USA?
We're around 20%. 1 in every 5 adults is
Wow.
taking some form of psychiatric drug.